Welcome to Veterans of the North. I'm your host, Trent Dilks, and with me today is Andrea Perry and Julia Pawlenty with the Veterans Suicide Prevention. You're here at a DAV convention doing the SAVE training. Welcome to the show. I appreciate your time.
Thanks for having us. Thank you.
You know, to start off, if you want to just maybe give us an overview of what your roles are, what your day-to-day job is in this arena.
Sure. So I'm Andrea. My job is a community engagement partnership coordinator for suicide prevention. So a ridiculously long title, a CEPC for short, but essentially I do community outreach.
Okay.
So my job is to go out in the community and educate folks that our veterans are at high risk for suicide and how they can help prevent that.
All right. And then Julia?
Yes, and so I am a prevention coordinator, background clinical social work. And my role is really, getting in front of veterans who are navigating a crisis. Also working to support the providers within our VA facility on what to do should I encounter a veteran in crisis.
Okay, excellent. So working at the community level, working on the more one-on-one and at that point of crisis level. So I think we got a great perspective. If you could just give me maybe an overview of where we're at in the veteran suicide crisis. This is something that I've been professionally doing this for 10 years, that it's gotten more attention, but it doesn't seem like it's gotten maybe the right tools, or we're working on implementing the tools to fix. So where do you feel like we're at in this, and kind of what direction, how you feel like we're going?
Yeah, so kind of just some basics from my perspective out in the community. So we know that veterans are 1.5 times more likely to die by suicide than a civilian. We also know that 2/3 of our veterans who are dying by suicide are not connected to VA. So that means they're out in the community and probably at large unknown, right? We're not asking or screening in non-VA healthcare settings if you are a veteran or if you've served in the military. So that's part of, we have to increase that awareness because we know that our veterans are at risk. And then also just really making sure that the people around veterans can ask about suicide and can have these hard conversations and know the tools to get a person who is struggling to. And so I think that was a huge part of starting my role out in the community. Is VA acknowledged that many of our veterans are not coming through our VA doors. We have to go to them. And so that's my role, is to go out into the community and get organizations, the faith community, first responders, non-VA healthcare systems to start looking for veterans, seeking them out, and then figuring out how to help them.
Yeah, I'd done a breakdown of the 23 report that came out in 24. I took the 88-page document, I made it into a 2-page kind of cheat sheet for those that were interested. And one of the things that jumped out at me were the diagnosis of veterans who had committed suicide. So those who did get care at the VA, and it had ranked them, and mental health wasn't in the top. It was pain. There were other indicators, which I think, as somebody who was coming from the outside and analyzing this for the first time, that I found kind of surprising was it was not a mental health diagnosis that was leading to that. And is that something, at your level, Julia, is that something that you've kind of seen, that correlation where maybe it's not what we would think, our kind of preconceived notion of the veteran who's going to be in crisis or commit suicide?
Yes, and so, I think, as you said, many people believe that those who die by suicide were living with a mental health condition, and in reality, right, many were not. And what a big piece is, I think, what's called universal screening. And so we're not only screening for suicide in mental health appointments, but we are also requiring all providers in the facility, primary care, specialty care, to be screening for suicide risk, as the majority, as you mentioned, aren't navigating a mental health diagnosis.
Yeah, and as we work on these other crises that we see in veterans overall, it had also jumped out at me that, homelessness in veterans, right? I believe the number was 168.5% more likely to commit suicide as a result of in that report. Justice-involved veterans. Veterans in high poverty levels. So the ones who are accessing the VA and are in those eligibility groups that are opened up, is it 5 and 7, that are opened up based on need, we see a higher level. So some of those things where I feel like a lot of us that are, feel like we're in the know, really aren't maybe seeing some of these indicators and those parts of the problem.
Yeah, you know your numbers.
Yeah, thank
For
you.
real. You've done some digging.
Yesterday, I met with 3 lawmakers in St. Paul, and they've decided to turn some of the state focus on this. So, yeah, it's not usually this fresh, but I went over my cheat sheet yesterday.
Yeah.
So,
Well, I think I just want to just piggyback on what you just mentioned, where we're talking about justice-involved vets, those, experiencing homelessness. We actually, about 2 years ago, formed a deflection work group out of the VA. And so I am part of that, where we are collaborating with the VA Police Department, with our justice involved, or our VJO, so Veterans Justice Outreach Program, as well as our homeless program.
Yeah.
To all work together, get upstream, right, develop relationships with those out in the community, also serving that population in hopes of preventing suicide.
yeah, it's finding those other indicators and getting upstream of the problem. But we know, and this is for you, Andrea, we know that a lot of them are not coming into the VA, right? You mentioned that earlier. And so that's part of your model, right? And it's not just for veterans to come to SAVE training. It's because a lot of people interact with veterans, right? Can you tell me how that branching out and trying to cast a bigger net, how that's going, and
For sure.
about that model?
Yeah, so I think, as I had mentioned, VA realized we aren't serving the veterans in the way that we need to in order to reduce suicide. So that was to create this community outreach program. And so in Minnesota, we were part of the first VISNs, Veteran Interconnected Service Network, to roll out the community engagement program. And essentially, it is educating everybody around veterans. Of course, we love veterans and service members and their families to be involved. But also, we have to realize, as lay people and civilians, we're not aware that a veteran is next to us or eating by us or working with us unless they're wearing something that indicates such, unless they share that with us, which we know a lot of veterans won't, right? Unwarranted or unprompted. And so essentially what our work is to educate people in the community to, number one, identify where veterans are. Ask them, have you served in the military? Many of our colleges are doing this, right? There's vet centers or veteran services on college campuses. But again, private sector healthcare, they're not asking that question across the board. Maybe even first responders, right? When a 911 operator would answer a phone call, are they finding out if that person is a veteran? Because maybe they have a law enforcement officer that could respond that's also a veteran.
Yeah.
So things can go better. And so in the community, what we really want to do is empower everybody to be able to ask about suicide. That's what our SAVE program is really about, is identifying the signs, asking about suicide. Are you thinking about killing yourself? Are you thinking about suicide, in a very direct way? And then validate that veteran's experience and encourage them to get care or treatment. Get them to the resources that they need.
And I don't know if it's the current training, but you had said it very specifically. You're thinking about killing yourself. And right before I got out of the Army, it was the first time I had heard that. They had kind of changed the model. And it was no longer use hurting yourself, right?
Yep.
Because if somebody has made that decision and gone that far, they may have convinced themselves this is not hurting themselves. This is the solution. So I think that's an important vernacular, is that, are you thinking about killing? It's a direct, pointed question.
For sure. And we want to make sure, too, with our veterans, right? A lot of veterans will say, don't beat around the bush. As a nurse that served them in the hospital, like, just come in my room and tell me what the heck you're here for, So that is very true. We want to be very direct with that question. We don't want to use words like hurt and harm, because that means something different to everybody. And as you say, many people who are thinking about suicide want to stop the hurt. They want to stop whatever pain they're in, and they think that's the answer. And so we have to be very direct. Are you thinking about suicide? And then our job is just listen. Let them share what they're going to share with you. Be with them in that moment of crisis, and then get them to help, right? Whether that's calling 988 or the Veterans Crisis Line, bringing them to a local emergency room, getting their family members involved, their battle buddy, whatever you can do so that that individual has other thoughts besides, I need to die right now.
Yeah. The moment of crisis, and that's where you really kind of focus your work, Julia. And can you tell us a little bit about that? What is that experience like? What, can you demystify it a little bit for us? And what is the moment of crisis? And, how do we know? How do you know when you're entering it, or when you see somebody else entering it? What are you seeing in kind of the practical?
I think that's a good question. And, what is crisis, I think, is going to depend on the person that's in front of you. What I'm able to carry, the weights that I'm able to carry could vary very, just significantly from what you're able to carry. And so really empowering that person to identify what they have and what they're navigating on their plate. Now, what do we look for? What are we listening for? So the warning signs, the red flags. I think one of the biggest things, I really encourage is to go with your gut. If it feels off, it likely is. And so maybe I can't pinpoint exactly what I'm seeing or what I'm hearing. If I'm getting that gut icky feeling in my stomach that it's off, we need to have further conversation.
Yeah.
Is it my mood is shifting? Am I noticing a change in physical appearance? Is this person becoming more withdrawn or isolated? Am I hearing, right? Like, I'm tired, I'm done, this is all too much.
Yeah. If your gut's telling you I should probably reach out to that person,
Yes.
trust it.
Yeah.
Right? Make that phone call, that sort of thing. There's something, even if you can't pinpoint it, there's something that, you've noticed without even maybe really analyzing it openly, but to be the one to make that call and to do those things, right?
Absolutely. And I think, for any of us, if we've been in the throes of hard stuff, reaching out or speaking up isn't always easy. Maybe not having the energy, the motivation to do it, maybe the fear, the stigma, right, of doing it. And so I think if we get that gut icky feeling or something doesn't feel right, to be that one that reaches out and starts that conversation. I'm concerned. I'm worried.
Because that downward spiral, that is lonely, right? That is isolation. That is lonely. And so as you're doing it, as you're working your way down that drain, the idea of reaching out after you've convinced yourself that nobody's here or there. So I think that's critical. When they do reach out, what is it? How are you doing? Like, what advice would you give for somebody who maybe is listening to this and go, you know what, I should reach out to so and so.
It takes courage, right? And wow, to be able to speak up and say, I'm not doing well, I need an ear to listen. That's courage. It's not easy. It is not easy. But there are people on either that be the other end of a phone. There are people on a chat online. There are providers in the VA or providers in community facilities. Maybe it's your significant other, a friend, a battle buddy. There are people around that want to help you to feel better, that want to help reinstill that hope. And when we speak up and say that we're struggling, many times we're surprised that those around us are also navigating something too.
Can validate that experience.
Yes.
Yeah.
And I think just encouraging people to ask for help, that's so critical. Like, that is the first step. It's a huge step. And at the same time, there are so many people in your life, even if there's one person in your life, they would be heartbroken if something happened to you and you didn't ask for help because they want to be there.
And I think it needs to be turned on its head, right? Asking for help is hard. It is strength. I think there's this, especially I come from the combat arms in the Army, and there's this macho thing, right? And as well read and as well educated as we try to get, there's still this kind of macho thing that tells us that that's a weakness. And I've said it over and over, and I think one of the strongest things you can do is admit that you need help, is to make that call. Because, climbing mountains, doing things that are hard, asking for help is going to be, one of the hardest, but one of those things that you need to have the strength to do.
Courageous. Yeah, that's beautiful. Well said.
So,
sure.
Another thing that is, I was analyzing that is when we talk about, and it's a tough conversation for veterans, is the lethal means and the higher percentage of veterans that use firearms to commit suicide. And then for women veterans, it jumped out even higher. I can't remember that percentage, but it was so high it almost sounds made up. So many more women veterans that commit suicide use a firearm compared to the general population. And I think that's something that you cover in SAVE training. I know there's always the gun locks. Can you talk a little bit about the theory behind the gun locks and what goes on there?
Yeah, for sure. Thanks for asking that. So I think that in our veteran population, for sure, I know that. And also in the civilian population, people die exponentially more often by suicide with a firearm. But in our veteran population, it's like egregious, right? Like it would be neglectful of us not to address lethal means safety, which in suicide prevention is essentially putting time and space between a veteran in crisis and their lethal means of choice. And so, as we've covered most often, that's a firearm. So, what can we do to put time and space between an individual and their firearm in the event that they get in crisis? So, to be very clear, it's not about gun control, right? We don't want to take away anybody's amendment rights. We want to support that and also keep them safe. And everybody in the family, right? Anybody who's in the household visiting, we want to make sure that firearms are locked up. And so what we talk about in SAVE training is when we create time and space, and Julia brought up this example of, maybe your firearms are in a safe in the basement. And so you have to walk through your house to get down there to get it. Maybe you walk by a family picture.
Yeah.
Maybe an Amazon package gets delivered. Maybe you get a text message or your dog barks or a bird outside is seen. Anything to give a person another thought besides, I need to die. So I think that's what's so important about firearm safety is just creating a little bit of time and space. A few minutes, 5 minutes could save a life. And then with, medications, kind of same thing is limiting access. So doing 7 days a week of medication instead of stockpiling 30 days at a time and having that in your medicine cabinet. And so how can we protect veterans, help them keep safe? That's in line with their ethics and their morals as well, right? What's important to them.
Yeah, and it's such a hard conversation. I've been in different meetings where this has been discussed, and there's these options. They're working on one in Minnesota where you'd be able to store your weapons, somewhere else, the Armory Project and things like that. And there's this visceral reaction from veterans like, no, you're not going to touch my guns. You're not going to do that. And so having that discussion and creating that separation, and, unfortunately, especially when, they consider the home defense or something like that. That's why they have them. The statistics tell us that it's much more likely that it's going to be used in a moment on crisis on yourself than ever in that kind of scenario that you've come up with in home defense and protection. And so really it's another line of defense, right? Get that gun lock on there. If it was me, I'd lose the key. So that would create all sorts of separation because it would be a real long time before I could find it. Get that going and create that separation, right?
For sure. And I think for, the home protection piece too, that's totally legitimate, makes a lot of sense. And I think after COVID, statistics were that there were a lot more firearms purchased nationwide, right? And I think that the point is if we can make anybody have a second thought, if we can have them, when they're in crisis, have a barrier between them and the gun. They can still have it for protection, right? It can still be by the bedside, but it's locked or it has a trigger lock. We don't want to take that right away, but it's a fine balance of thinking, how often are you going to need this for protection? And how many times, as the research shows, much more often people die by suicide with a firearm than exactly as you pointed out, than in a case of self-defense.
And another thing is I've looked at this issue I get concerned about is addressing the actual demographics, right? We see, especially in the nonprofit world, there's a lot of things that are kind of aimed at mental health, but they aim at very certain populations. Your combat veteran, your younger post 9/11 veteran. And then I know at least in Minnesota, when we look at the veterans who committed suicide, we were looking at an older non-combat veteran. And I've told people my frank opinion is that's not a sexy demographic to work with, right? And I'm afraid that the resources aren't getting to who the statistics are actually seeing. Is there a way we can do that better? Is that something you've seen? Programs like yours can help. Like, it might be someone who doesn't even call themselves a veteran because they served during the Cold War and they discount their own service.
Yeah, 100%. You're hitting on all these points. You could do my job. For sure. So I think, yes, that's so true. And some of the ways, like what came up in my mind when you're talking about that is peer support, right? And how can we reach veterans who aren't necessarily connected to a smartphone? They're not on Facebook. They don't have, a chat option, whatever it is. How can we reach them? And I do think that's veteran to veteran. And part of our work is really connecting veterans to other people like themselves so they know who else is in their area. We had a coalition that did coffee talks, and so it was veteran-led, peer group. People could come and talk, drop in once a week and talk about whatever they wanted to. And so it doesn't have to be about mental health. It could be talking about your dog or your spouse or your job, right? And that can relieve people. That can give them hope just to share that. So I think you're spot on to say that we need to look at all demographics and how can we target those veterans who aren't necessarily online. That's more in person, and rural veterans too, right? We have a really hard time reaching rural veterans in Minnesota. And that, again, is so why our work is just the world is our oyster. We could be coalition building and out in the communities till our face turn blue because there's so many people to reach. And I think it's just really enabling your neighbor, everyone around you in all communities, to see that you have the power to connect to another person. You can ask them how they are. You can ask about their service and then get them to the appropriate resources in every area. We know we have mobile crisis units, right? Every county has a mobile crisis unit that can come respond. We have 988 pressing 1 to the Veterans Crisis Line. There are so many 24/7 resources that people just have no awareness of, and are not connected to.
Yeah.
Well, I think that's too the importance of getting to all of these events, right? These conferences, and going to the fair where where they're playing and engaging in activities, is getting out into the community to put the resources at their at their fingertips.
I had talked with somebody in another organization that has the clubs, the bars, and they had talked about wanting to try to get the bartenders safe training.
Yeah.
Yes.
Right? If you're going to see somebody as they're going into crisis, it may be there. It may be, something that's absolutely going to, feel the negativity and things, but it may be where they turn. So finding creative ways like that, it sounds like, to new access points.
Totally. Right. Your server, your restaurant folks, your barber, the people who cut your hair. Like, who do you see that would notice and cue into these things? Your local pastor, right? The faith community is huge. And we know, too, that most people aren't going to reach out to a mental health provider, even if they're well connected. They're going to go to their friend. They're going to go to their brother. And so making sure that everybody around us is equipped to help is just that huge public health model. That's what we're here to do.
A lot of what we hear, and I'm sure what you hear, is people want to find ways to help. Right? They want to. They're community groups, individuals. They want to find ways. They hear about the devastating numbers of veteran suicide. Is it creating connection? How can the individual or the small group in a rural town that is concerned about this, what can they do practical to take those steps to create ways for that?
Yeah, great idea. I think we probably both have thoughts on that. I think, first of all, talk about it, right? Ask about suicide if you think someone's struggling. Share mental health struggles. Share what you're going through. Normalize those conversations that we hide, that we don't talk about. And I think since COVID, that's more accepted, right? More people are used to others around them struggling. It's a little bit more normal. We've come a long way, but there's still a long way to go, especially in the military culture, as you talked about, right? That was looked upon as weakness. So telling people, hey, I really want to hear where you're coming from and I want to hear about your story. And I think it takes a lot of strength to share it. So I think normalizing conversations, SAVE training, right? That suicide prevention training, bringing it to wherever you're part of, a book club, your church, your local chapter for DAV. Bring us in so that we can come and talk and share these stories, and that you can ask questions so that hey, what works for me in my community is this, and what's not working. The veterans I see are struggling with, substance use. How can we target that? So every community is so unique and all the experiences are so unique, and we want to be able to reach out and connect to all those people.
I would agree. I mean, I think that we can't say enough how important it is to talk about it. I think, right, to be loud about the things that are important to us. To, when we have that concern, to not sit back and wait, right? To wait till if I connect with them again next week and they're showing up the same way, I'll ask the question then. If they don't show up to happy hour, tonight I'll check in then. To not wait. As soon as we have that concern, we're checking in and creating the space to have that conversation.
Absolutely. SAVE training. If somebody, were interested in bringing that in, is there a website? How would they go about, initiating the steps to bring safe training to their community?
For sure. Email me. You could go to, on our VA website and reach out. There are a ton of different options. So there's safe training offered online through Psych Armor. And so people can take a 25-minute version if they don't want to hear Julia and I blab for an hour and a half. Otherwise, yes, get a hold of us at VA, anyone, and they will know how to get you to safe training. And so our suicide prevention team offers it virtually, in person. There are recorded options. We can come to you where you are. So I don't know, can I just provide my email on this?
Yeah, if you're all right with that,
Sure.
we can provide that, and we'll get it into the info on this episode.
Yeah, so it's andrea.perry@va.gov, and it's Perry, P as in Paul, and so that is our bread and butter. We're happy to do it anytime. We just want to spread the word about, training and resources.
Excellent. And you just did safe training here at the DAV's DAV Minnesota's 100th convention. Good turnout. You had some people show up for it.
I think I counted about 80.
Wonderful.
Oh.
Yeah, it was
Yes.
awesome. It was a great turnout.
And that's access points that are going to spread back out across the state. So
Yes.
that's wonderful. I guess, as we're looking at wrapping up here, I would ask just if you had some words of wisdom, both of you, something something you'd like to provide to our listeners, those who may be, in crisis, coming into crisis, or those who could potentially, come across a veteran that's entering or in crisis.
Yeah, I would say, that people know that they matter. We're all different. We all have struggles. As Julia said, we all have something on our plate at many different times in our life. So knowing that we're worthwhile, we're here on this earth for a purpose and a reason, and there are people who care about us, and reach out to someone. Even if you don't feel like that in that moment, it's so important to tell people around you that you're struggling and that you need help, because there are a lot of us, Julia and I are two, of very many people who want to help, who are here, who want to get you to resources, who care about you. And it's so important just to make that first step and reach out.
Thank you.
Yeah, I think that I would echo that this is a season that, we are here, somebody is here, the resources are available, so we encourage you to utilize them. You're courageous, you're brave. The biggest step is asking for help.
And if there's a veteran in crisis right now that's hearing this, it is 988 press 1. Right?
You got it.
We've got the new 3-digit. We don't have to. It used to be, but 988 press 1. Well, I thank you both for being here, Andrea Perry and Julia Pawlenty. Thank you so much for engaging in this discussion.
Thank you for having
Thank you.
us. Thanks so much.